You are gathering a lot of personal data about yourself, and you will be gathering exponentially more over the next years as we move more and more into augmented reality, virtual reality, metaverse, etc. But even without that, well, what is happening with your data? Who owns your data? Who gets paid for your data? I'm Ines O'Donovan, and I would like to share some of my key insights from this week's San Francisco Blockchain Week in November 2022 with you. So most of the information is based on the event that Zero Labs had organized, but also on conversations with other people and other events. Let's talk about your data. As I've said, you are collecting a lot of data about yourself already, and it will explode exponentially over the next years as you're using more and more devices, wearables, ingestibles, implantables, etc. throughout your daily life. So just think, as we are moving into the metaverse, for instance, think about headsets, think about haptic suits, think about implantables in your brain, think about ingestibles, like little tablets that can look at you from the inside and can create a lot of amazing information for you and about you that you can use, theoretically anyway, to get better health, to get better treatments that are personalized to you. But that brings the problem of ownership of data. Who owns the data? Really, in Web 2, the business model of organizations was that you get access to services for free or for very low cost, but at the back of that, those companies sold your data without you knowing it to other organizations, companies. And basically, industry kind of sold about $200 billion a year data of you, not individually, but overall. But I'm sure you have never seen a check in your letterbox, as Andrew Young shared in his talk at 0x Cross Labs. So owning the data is very important, and it is really the key to Web3, that you own your own data. But this brings a lot of thoughts that you need to consider as an individual, but also as an organization visit, especially if you are in the field of health, aging, and longevity, which you certainly are as an individual and potentially also as basically a corporation or an association. So you do want to think about things like, as an individual, for instance, you want to think about things, okay, I might have to pay for services, but in return, I can demand, if I'm giving my data and make them available for other companies, for instance, for research, etc., I can say, okay, I give you my data, but in return, you lower the fees, or I get your services for free, or I get kickbacks in whatever way that might be. And but it also means that you are accountable for your own data. So you need to think very carefully about who you give access to, how much access, at what time, etc. So if you, for instance, again, think about the idea of healthcare, there are certain situations where the hospital, for instance, just needs to know you're insured or not. So they do not need all the access to all your information. And there's a protocol that I've just learned about for if you're a techie. It's called the ZK or ZK, depending on where you're coming from, protocol that basically says, okay, yes or no, which is important for like the hospitals, of course, for healthcare providers, but also if you think about human resources. Right now, they're getting a lot of information about you, even if it's just about, okay, are you pregnant? Are you on sick leave? They do not need to know all the background information. And they do not actually want to know all that background information, because that might make them liable as well. So there's a lot of stuff that you need to think about as an individual, but also, and there was a really interesting panel about that, and at Zero Labs, the Crossroads event. And you need to think about things like governance. What about revenue sharing, especially if you think about actually DAOs that are very popular right now? So decentralized autonomous organizations. And you need to think about governments, revenue, profit sharing. You need to think about liability. You need to think about anonymity, especially as we talk about the health space. Because as I've said, like a hospital, a company, they do not need to know all the other information. All they need to know about you is, okay, you're insured. Okay, yes, you're on sick leave. But if you want to get the best care, or as a healthcare provider, as a practitioner, etc., want to provide the best care, more data is needed. So without knowing a lot of, like your health data, blood pressure, your blood sugar levels, potentially some genetic information, your wearables, ingestibles, implantables, all this other information, if that is not available to your physician or to your coach, longevity coach, for instance, then you might not get the best care. So it's really, really important to take all this into consideration from both sides, and then really see, it's like, what is the most important? What decision do you make? In general, overall, I think having more data available and you deciding what to do with it, and probably also needing to learn about how to make those decisions in a good way, is important. But it provides all of us a great potential in order to live far healthier, happier, and longer. So with that, I leave you, and I wish you a wonderful day, and stay healthy, stay young, have fun. Bye.